everyone, and welcome back. Lisa and I are here today to have a conversation about mental health. This is now Mental Health Awareness Week, and it's very important that we consider what that means for everybody, and not just those people who have very good mental health, but also acknowledge that there are people with poor mental health as well, and what that actually means. The theme for the week is kindness, so we're going to talk about the importance of kindness and what kindness actually is in terms of mental health understanding and awareness. And everyone has mental health. Everyone has a right to good mental health. So some of the challenges around discussing mental health awareness this week are very much around acknowledging that not everyone will feel well and have good mental health all of the time. And good mental health is very much associated with quality of life, meaning and purpose, a reason to get up in the morning, connections with people, feeling understood and being able to live a meaningful life in society. So we're going to have a conversation about the reality of that and acknowledge that whilst it's not always easy for everyone to have good mental health, that in fact there are things that we can do and ways that people can be engaged in how we work for their own mental health and for better emotional well-being. Okay, Lisa, so maybe something around what you feel about that?
Yeah, I think I'm very aware with it being Mental Health Awareness Week that there are really important messages going out there about the things that we can do, and it's a lot around our work as well, and the videos we've done are the things that we can do to support good mental health. I'm also very aware of the many years that I was very unwell. And there's been a lot of discussion over the past year about parity of esteem, which is physical health and mental health having equal importance. And I think Mental Health Awareness Week, if I think back to when I was really unwell, how some of the messages going out there at the moment would be quite difficult where I was at to in fact receive and even think are relevant to my life. And I think people with long-term, severe and enduring mental illness, I think this week can be challenging, and I think it's important to recognise what is going on for those people, because if I think about me acutely unwell for many years as an inpatient in and out, that me didn't have a voice. I wasn't able to speak up or say what was going on for me. I felt powerless, I didn't feel heard. I didn't feel that people really got where I was at, and I think there's a lot of talk at the moment about what's going to happen with people's mental health with the crisis, planning for the future. There's even discussions about people being OCD because everybody's trying to keep clean, and I'm quite sure that people who really have OCD, very debilitating experience for people, are thinking actually people don't understand what that's like to have OCD, because I've been living with this and it affects different people differently. Same with the likes of depression. People are feeling sad, stressed. It's a very different thing to actually have clinical depression where you wake up every day hopeless. It feels like you're trudging through quicksand, like you're drowning. And it can be different for different people as well. We make assumptions that we know what people are experiencing, and yet I could be showing up with my makeup on and smiling in a room full of people, and what's actually going on in the back of my head if I'm really suffering from depression is a very different thing. So I think there's a lot of misunderstandings, misconceptions, assumptions made about people. And even understanding with the current situation, if you've got severe and enduring mental illness, how this situation may have made that worse. I'm thinking as well about, we're talking a lot about going online with things. I was having a conversation just this week with somebody who has been in services a very long time, who was saying, what about access to a laptop? I actually don't have money for the data, getting Wi-Fi access. Accessibility issues. There's been with the benefit system changing around and people being transferred from DLA onto PIPs. A lot of people have been, most vulnerable in our society, have been very hard hit by that. So even in terms of looking at plans to accommodate the isolation, sometimes those on the fringes are in fact further isolated because they don't have access to these things. And I feel very strongly that in Mental Health Awareness Week we can't forget about the people out there. And on top of that, you've got people caring for people with long-term mental health issues. It sticks in my mind having a conversation with a carer who has cared for their loved one her whole life really, and saying, you know, the professionals are telling me that my loved one needs to give up smoking, but they don't understand that that's one of the few things that calms and settles and that they get some pleasure or satisfaction with. And I think it's easy to sit on the outside and talk about these things and good mental health, and this is what we need to do. And the reality for some people is very different. I remember they did a survey, I think in 2015, the SenseMaker survey, looking at people's experiences across Northern Ireland of using mental health services. And as part of my QI project last year, I actually had the privilege of reading through the stories in that. And I think every professional would need to sit down and read those stories, because what came out from them is the reality of people's lives who are actually dealing with this day in and day out, and the importance within that of empathy and kindness. The good experiences, what shone out from those was people being treated kindly, being seen, being heard, and the not so good experiences were people who didn't experience that. I know in my own life, I mean, when I was unwell all those years, separated from my husband, we have to recognise the impact on carers' mental health. And I've asked Gary if he's okay for me to share this, but he is a loving, kind, generous, hard-working human being who, dealing with my severe and me just being acutely unwell and all that came with that, in order to be able to look after himself and protect his own mental health, and to be able to look after my 2 young children, we had to separate. That was a choice, a very difficult decision that he had to make because of his circumstances. We didn't have family around to help, even though we were very lucky with our neighbours. And I think carers are very often a forgotten group of people in all of this, and can also be judged for the things that they experience, and in fact what comes with caring for somebody who's very unwell. Remember him saying, it doesn't matter how much I loved you, I actually couldn't fix you, I couldn't make you okay. And that's a very heavy burden for people to carry. And in the current crisis, we have carers out there, not just carers of people with mental health challenges, but people who are living day in and day out with very, very difficult situations. And we need to think about the impact on their mental health and well-being too.
Yeah, I hear that, and very important, Lisa, that you highlight the broad range of people with caring responsibilities. There's also something too about people not considering themselves as carers. I mean, Gary was first and foremost your husband.
Yeah.
And people don't always consider themselves to be carers if they are a husband, wife, a parent, a son or daughter. You don't always consider yourself a carer, and therefore it can sometimes feel a bit like anything that is done or talked about in terms of being a carer, you might feel that that has nothing to do with you, because it is not your primary role or your primary responsibility in your relationship with that person. So I think there's something too, for me as a professional, being very clear about that and giving that message out, that we all have caring responsibilities and caring roles in life, and sometimes whenever our relationships are very much caught up in having to care for and provide care for and support someone who's very unwell from either a mental health condition or a physical condition, that it can be very difficult to see what your role actually is, and the change in that role can be very dramatic as well, and the change in the relationships can be very dramatic. And I suppose the message for me is that carers and people who support others, it's about being there for people and supporting people and that you have needs as well, that we all have needs, mental health and emotional needs.
Yeah, and I think what you say there has also just brought something to mind, really important message for professionals as well, people working within the health service. I've had the privilege of being able to work and facilitate at different events and speak at different events about my own lived experience. And what has always struck me is the conversations I've had with staff after, staff who are caring for somebody with mental health challenges, staff who've come to say they could never talk about their child who's self-harming, experiencing suicide in the family, dealing with members who have long-term severe and enduring mental illness, and in fact not being able to acknowledge. So like we always say, our workforce is a representation of society, and although we've definitely come a long way in terms of mental health, it needs to be said and acknowledged that there is still judgment, there is still prejudice, and I know staff from the courses that we've run have said themselves there's somehow judgment around, if I'm to acknowledge that I have lived experience, what does that say about my ability to do my job?
Absolutely.
I'm employed in a role that says it's okay for me to do that, but what is it about other staff members? So I think it's important just to acknowledge that.
And I can identify with that, Lisa, because I'm a relatively well human being. I have good physical and emotional well-being, and I am challenged at times, and I'm challenged by the same things that everybody is challenged by. I'm not mentally ill, thankfully. I don't have a mental illness nor a diagnosis, but I know what it feels like to be emotionally challenged through stress, pressure, expectation, overwork. I mean, and I mean, it's not that my workplace puts a lot of work on me. That's the kind of person that I am. I take on a lot. I'm willing to take on a lot, and then I find myself overwhelmed. So there's something about in terms of taking care of my mental and emotional well-being, pacing myself, looking after myself, and being measured in what I take on, being very reflective. And I would have to say that in times when that has been more challenging for me, and I have felt at some points sometimes quite low and unable to get out of the morass that I find myself in, that in fact coming to work and having to pretend to be well, having to pretend to be okay and that there's nothing wrong, has actually made that feel a wee bit worse at times. I'm very lucky at work that I have in fact got a really good team around me in terms of support, some really good colleagues and good friends and yourself to share some of those very challenging experiences with, on what I find and what I have realised is that it's not uncommon that in actual fact much of what you think and experience at work in the working environment and as a human being is very much similar to what I experience. But being open about some of those emotional challenges can be very difficult, because there is that idea that, well, if you're a member of staff, you should be well. You shouldn't say that. You shouldn't feel that there shouldn't be anything wrong with you. So showing up as this person who has it all sewn up on the surface can be as difficult as actually showing up with challenges, because that takes more of an effort. So having open, reflective conversations, having good support is really, really important. It's important to me as a member of staff, as it is for you as a member of staff and a person with lived experience.
So I think, I mean, there's a lot in this, and it's not an easy discussion, and it's not easy to look at sometimes the reality of how things are, but we always talk about what can we do, and there are always things we can do. And in terms of our work and the way forward, it really is looking at those of us who are able to have a voice. It's about lobbying and standing up and speaking up. There was a time I needed people to speak up. And, you know, there's things around mental health gets a pitiful 6% of the budget. We need more money and resources. You know, government needs held accountable for that. Investment needs to be put there. But we can also, within our day-to-day work, the co-production guide, which is part of the Delivering Together 10-year strategy, is about how do we create the conditions where we give people a voice, where we hear about these different experiences, so we understand from a professional perspective, what it's like to be working from somebody who's having lived experience perspective. What is that like? How do we come together? Because we're all different and we all have different experiences. So there's not like a package size of one size fits all.
Yeah.
So I think it's really important to look at, yes, how are we doing that in our own work.
Absolutely.
And we'll check in with you on our next video, looking at how we as individuals can very much bring kindness and make change to our relationships. Thank you.